Well, we are here this afternoon to look and feel and integrate how we can release the effects of trauma in our lives and thereby do the same with our clients through breath work. And this is such an important topic that we devote an entire session to this, which Lenny and Jayne have prepared for us. So without further ado.
Thank you, Jim. Hi and welcome. Jayne and I are going to be talking about trauma and how it relates to breathwork today. And I don't want to come off as the expert that knows all this. There's a lot of knowledge in this room too, and we'll probably have a little bit of time to share some of that too. But we're going to present a few things, a few concepts, and we're going to mix in some techniques that might be helpful to use for yourself as a breath worker or to teach to clients and do with them. We'll mix those in between some educational pieces so that you kind of have some hands-on activities to do and some background knowledge. So my goals are for you to understand a little bit more about how trauma affects the brain and realize, and I'm still learning about this, that this is also an evolving area. We're learning more as science is advancing things, and we're more able to capture images of the brain in different ways. And so with these techniques, I want each of you to have one that you actually feel comfortable with walking out of this room today, at least one. You'll have a handful to experience. So first, we're going to start off with a definition. So trauma is a deeply distressing or disturbing experience. This is one definition. And experience is the key word there, not event. Because one event may be witnessed by some person and it's benign to them. It doesn't have any impact. The same event may cause very extreme fear and a traumatic response in a different person. So it's the person's experience that's key. I like to say trauma is in the eye of the beholder, to steal some, I think, Shakespearean quote. In other words, it doesn't matter what you think or how bad it sounds or any of that. Another definition is an emotional shock following a stressful event or physical injury, which may be associated with physical shock and sometimes leads to long-term neurosis. In other words, an experience that overwhelms the coping systems. So that's another way to think of it, an experience that overwhelms the coping systems, whatever that person has in terms of abilities to separate, themselves from the situation or understand what to do if there is something to be done. We're going to talk about PTSD a little bit. I say, forgive me a little bit. So I do counseling, one-on-one psychotherapy with people. And so I do sometimes slip into diagnoses. And I know you're not here to learn about diagnosing people, but I will use some of that language because it's actually pretty common language now. Words like PTSD, which stands for post-traumatic stress disorder. It's technically a diagnosis, but it's pretty much in common language used very often. So my intent is not to teach you how to diagnose or really to understand them, but to understand some terminology that's going to be used. You will probably have clients come in at some point that say they have PTSD. For some, that's equal to trauma. I have trauma in my background. So I'm not going to get into the details of diagnosis to distinguish what someone might come in and say versus what the DSM-5 says is the diagnosis criteria. Okay. This first handout has a little bit of background. This comes from the National Institute of Mental Health, talking about post-traumatic stress disorder. Also note that you don't even have to have witnessed a traumatic event in order to feel trauma or develop PTSD. You can hear it. There's a thing called vicarious trauma. And so you might hear it from someone else who experienced it firsthand and then start to carry and have symptoms of experiencing a traumatic event and have never experienced it. So I'm going to call that back to the experience. As a listener, I might be experiencing it through someone else. I might develop this symptoms of trauma that way. That's vicarious trauma. There's other terminology, and then I'm going to step back from the clinical terminology. Complex trauma is another term or phrase that's getting used more and more. And it's not like how many factors there are or how many tentacles of maybe triggers or things or symptoms like that. It just means multiple traumas is really what it means. In my experience, that's most of the people that are coming to see me is multiple traumatic experiences. This came to light basically from military veterans coming back after combat duty, and they called it shell shock in the past. That was kind of the first version of PTSD. But of course, we've realized that it's possible in lots of other scenarios. I don't need to list them all, but just to give a little bit of perspective, anything from a car accident or an abuse, physical abuse, sexual abuse. It could even be something like an elective medical procedure. You're choosing to have dental work or something. Even things you're choosing to have happen can become traumatic events. So there's quite a range of possibilities.
Just another one that we're seeing more in the news lately, but goes across many different areas is the trauma of oppression over a lifetime or lifetimes.
Yeah, we're actually starting to see, there's research showing that I think the right terminology is in your genes, the genetic makeup, the telomeres, the ends of some of the genetic code causes certain genes to become active. It's not changing your genetics, but stress and trauma can cause some genes to become active, and then a symptom or a disease or something shows up. And so that has been shown to be actually traced scientifically 3 generations. A trauma can be traced 3 generations. That's scientifically. I don't know the limit. Maybe it goes beyond that. I believe that. So how does trauma show up? Lots of ways, infinite ways, but there are kind of clusters of symptoms that are common. Flashbacks. And so that is like re-experiencing the event, living it again. So it's to distinguish, it's not just remembering it or not just playing it over in your head, it's feeling like you are there again. That's the distinction between a flashback and maybe a memory or recollection. Nightmares, being triggered or triggered easily, avoidance. So, don't go to that part of town, or don't talk to that person, or don't go to that building. Hypervigilance. So that's just being on alert all the time, looking for a danger. And understand that all of these are coping mechanisms. They're ways that helped a person get through a tough situation. So they are helpful in some form, but we're trying to get to a point where they don't have to fall into some of those things, because they can be very disruptive to relationships, to jobs, to friendships, life in general, those symptoms. Another way it shows up is, I see this pretty often, is just difficulty completing basic tasks. Often the brain is in a state that they have a hard time following instructions or following through with things that they may have committed to. So it's almost like sometimes I'll even have a client, I'm like, I know this is an intelligent person, I know this is a capable person, and then they can't do certain things that I believe they can do. And I think part of it is that trigger, there's some element of stress or triggering that's happening that prevents them from really living up to their potential. So I would say slow and deep. So like belly breathing is one of the antidotes to a stress response. And so when I think about trauma, honestly, I think it's a stress response, and there's a whole spectrum there. And so it's not a yes, no for me. I know diagnostically there are yes, no questions that we come to a conclusion on, but for me, it's more of a spectrum. And so it's a stress response. And, I'm having a stress response right now. I have to present to people in a room. But there's a whole spectrum there. And so, yeah, breathing slowly down into the belly is diaphragmatic breathing or yogic breathing. You may have different terms for that. We're going to come back to a little bit more on the genetic side, but what that does is it stimulates the vagus nerve. This is a relatively new area of study. I'm not an expert, but I've studied a little bit about it. And when the vagus nerve is stimulated, it sends a signal to your brain to shut off adrenaline and cortisol, which helps to calm you down. It helps to have these physical symptoms, even all symptoms to die out.
One of the things that can happen is we can start to feel a little bit overwhelmed with an emotion. So we're all about feeling our emotions, right? in this work, in this setting. But when it feels overwhelming, it can do exactly what Lenny was saying, block our capacity to learn. And that's another sign of trauma. It's like people not being able to be in learning settings because it's like, so the trauma might be so overwhelming. So just wanted to give us a little exercise for a moment as we are human in this listening experience, so that we can also be present. So there is a really cool acupressure methodology of relaxation. It's really easy to do in like a meeting setting, like if stuff comes up in a meeting, stuff comes up in a classroom, that you can do it and still remain kind of anonymous with it if you'd like, except if some of your learners are in the same classroom as you or same meeting. I'm just going to go through some fingers really quick. And you might want to write it down because we won't spend too much time. One of the things I have people do when I'm coaching them, so I trace my hand. In the United States, we often do that like in kindergarten and do little exercises with that and make turkeys and all those things. But this is actually a way to, if you want to trace the hand on your journal, it is a way to remember these points, and they're acupressure points. So based in Chinese medicine, you just have to have a gentle hold. So I'm going to gently hold onto my thumb. And you don't want to squeeze the circulation out of it, nor do you want to be super light, but just kind of a nice gentle hold on my thumb. And that the thumb has to do with grief. So helping, if we have a sadness or an overwhelming feeling of sadness coming up, that we can help that to come down a little bit so we can be a little more present. So the thumb is sadness or grief. Then it's interesting that there's fear and anxiety on different fingers, but the next finger, the pointer finger, has to do with fear. So if I'm feeling an overwhelming response of fear, it just helps to take that overwhelm down. And I, of course, breathe with it. Imagine that. That's how I got into this work. I was explaining that to some people. It's like all these activities, all these modalities, the center is always breath. Then you go to the next finger, and you probably could remember this one. It has to do with anger. So if my anger is getting out of hand or it's like overwhelming, I can bring it down by holding on to that finger.
Hold it instead of flip it.
Exactly. Exactly. And then the next finger is the ring finger. So anxiety, sometimes people have anxiety about the commitment. Often we put a ring on this finger in marriage. So you can think of it that way if you want to remember. So if you have anxiety, it helps to reduce it. And then interestingly, this is more about like confidence. So you're walking into a situation, you feel small. You can go and hold onto this finger to augment that sense of confidence. And you could use that as like even a 5-minute meditation if you wanted to in the morning and the evening to integrate the emotions. But you can use it within the context of a meeting, or even if you're the breath worker and some fear comes up for you in a session as you have watching somebody breathe, you can hold your own finger as a way to balance your emotional state while you're supporting that person, because that happens, right? We can get triggered in a session as a breath worker. So it's just a way to do that.
Some other things that trauma can show up as, again, I'm going to slip into diagnoses, but a lot of these terms are just common language now, but things like anxiety that we just talked about. So is it anxiety, or is it really the trauma that's showing up as anxiety? This is a question to try and explore. OCD or obsessive behaviors, right? That's managing the threat or managing the stressful situation. If I have control and order over things, it's easier for me to go into a difficult situation, perhaps. Substance use disorders are super high, probably higher than 80%. with people with trauma have co-occurring substance use disorders, so alcoholism, drug use, and things like that. And so it can be tricky. Again, I know, we're talking about breathwork context here, but I do encourage people to do a little bit of background as they're bringing clients in. And so we'll talk in a minute about, ways to assess that. Could be a conversation, could be forms, but to get a little bit of background and at a minimum, ask if there's trauma in the background, either on a document or in a verbal interaction, because that might influence the course of your working with that person, the kinds of things that you do with them. It also helps facilitate a conversation if they have specific things they want to avoid or need to share. So even just a checkbox on a form or something is a start to that conversation. Okay, we're going to do another activity. This is part of Stephen Levine's work. His phase 1 is a containment activity. And so the body is like our container for our sensations, for our feelings. And when trauma occurs, often there is a rupture of some boundary of ours. And it could be physical, but it could be emotional, or maybe we have an ego image and that got destroyed or something like that. So this can happen on so many levels, but often there is a rupture of a boundary of ours. And so this exercise helps to restore that boundary. It's simple, not necessarily easy, but I invite you to try this exercise today. And so there'll be a little bit of noise in the room as we do this. So, try and stay in your process, and then we'll come back. This will only take us a few minutes, but this is a tapping exercise. It's not tapping. There's some other techniques like treatment modalities that they use the phrase tapping for. This is not that, but it is an act of tapping. So hold out your left hand if you're comfortable, willing to try this. Your right hand, 2 fingers, and you're tapping on your palm so you can feel it. And you say, "This is my left palm.
This is my left palm.
My left palm is a part of me.
My left palm is a part of me.
My left palm belongs to me."
My left palm belongs to me.
And stop and focus on it, the sensations, what you see, what you feel. Breathe. Notice. You don't have to answer. Often there's tingling or maybe even pain. Maybe it's numb. Maybe it feels hot. It's all possible, any and all. So we're going to move up and we're going to do the same thing. This is my arm.
This is my arm.
My arm belongs to me.
My arm belongs to me.
Look at it as you do it. Look at this area you're poking. You're focusing on that area. My arm is a part of me.
My arm is a part of me.
And stop and focus on that area and feel what you feel. So I'm going to pause there and open up for just a comment or two. Just take a moment here. Did anyone feel anything and during that process?
I felt like somebody was grabbing my arm
Okay,
tightly.
thank you. I'm just going to listen for now. I'm not going to comment. Anyone else have a sharing?
When I was tapping the palm of my hand, that felt more vulnerable to me
Mhm.
than my arm. That's just something I noticed.
Thank you. One more?
Yeah, I had an image of my father who died when I was 7 years old. But I was probably 5 when I was looking at the picture.
Thank you. Mute.
So I have a question. When you have somebody with trauma in their life, like I almost wanted to crawl out of my skin when I was doing this. So do you have an alternative to offer up to them? Because like I don't really like doing these kinds of things, and I'm sure I'm not alone in that.
Yes, there are many alternatives, and I'll give a couple, and then I'll say that you could probably make up some from within this context. But try and recall, we're trying to reestablish that boundary, our own boundary. And so one of the other exercises is the client would do this on their own in privacy, but just a shower, and then just focus and have different parts, have the water hit them in different parts. That's it. and, okay, it's hitting my arm. You don't have to say out loud any of those words. That the words can be powerful. I think they're helpful, but they're also triggering too. So that's one example that still has that interface, right? This is where I end and the rest of the world starts, everywhere. And so it is important to start to reestablish that. And so activities like that, you can do something even perhaps milder, which is sometimes I'll use a string of yarn and I'll say, where is your safe boundary? How close can someone get to you for you to still feel comfortable? And I'll have them lay that on the ground and make a circle around them. And so again, it's starting to establish a boundary when it's been lost or broken or damaged.
And this might not be true for you, but for some folks, it's hard. A lot of people will express trauma as, I feel like a head walking around without a body. And so anything starting to reconnect the body, anything that brings me back to the body can be really scary or uncomfortable. The other thing that happens, I've often heard is from folks that I'm working with is like this, it's a lot of this like brain fog feeling too, is another aspect of trauma.
Thank you. I really like the words around all of these because that's, I think, eventually going to have to be a part of the practice if you're creating a safe place for yourself in the world. And, if people are taking advantage of you or if people are not listening to you or whatever. So I think words end up being a critical component. To practice this in a safe place is helpful for when you're in a more challenging situation. So it doesn't have to be there, but at some point I want some of these words. This is my space. You can't come in. Things like that. You can also do muscle massage, but that's kind of close to the tapping. So you would maybe just squeeze. This is my arm. These are this is a deeper container for my feelings and sensations. And then you would, so back to the tapping exercise, I actually have people, if they're comfortable is a subjective word. If they're willing and able to manage the sensations that are coming up, we go, yes, the palm, the arm, upper arm, shoulder, we go up the other side, we go down the torso, we go down the legs to the feet with that same deliberate action, right? This is my right foot. My right foot belongs to me. My right foot is a part of me. So that's the complete exercise, would be the whole body. But sometimes like we do two things and then that's enough.
I was wondering if the sensations that one feels while doing this carry any significance, like if one feels pain or numbness, or like, does that matter? Should they acknowledge the sensations or do they mean anything?
Probably. There isn't a template for meaning, right? It's going to be individual to each person. And so you might explore that, but yes, there probably is some importance there, but I think it's personal and different by the person. But yeah, that's another area we're developing language. So tingly, hot, numb, whatever it is, this is helping get back into the body more and connecting all of us together rather than segmenting ourselves. Yeah, good question.
Oh, I guess I'll just clarify that I found when I did the squeezing, it didn't feel as violent or as intrusive as the tapping. So I just thought I would throw that out there. So maybe if the tapping feels too much for the person, squeezing or something gentler might work better too. Not just to build on what Lenny was saying about finding something that works for people.
There is another activity. People were asking for alternates. We got a lot of activities, but even interfacing with an animal can be really powerful. So that can be just watching a squirrel. Or that could be, or a larger animal, just watching them move, just they have that natural, they're in their bodies, they're fully inhabiting it. And that can also be a segue or a start into me being able to get back into my own body. Of course, pets and closer contact, I'm not going to say is better, but is another way to do that, and also potentially very powerful, very grounding. There's service animals. Obviously, this is fairly common now, but also I think we can observe and measure the difference happening within people too. It's not just anecdotally helpful. I want to honor everyone in the room here and those that have shared. That takes some courage to do that. And this is a really hard topic. And so, no one has to say anything or anything, but just please know that as other people are sharing, it could be a super deep wound that's coming out here. And so we've been awesome at respecting other people's emotions and their space and their energy. So thank you for demonstrating that.